So we're now onto our run assessment, and it's important that we break this down into the different phases of our gait cycle. So our stance phase, toe off, initial contact, and so on. We also want to break it down into the different planes of motion, sagittal, frontal, and transverse. This helps us break down complex pieces of visual information into much more bite-sized, manageable pieces. It's then up to us to analyse whether or not what we're seeing may be related to an athlete's low back pain or not. Sometimes it will be, and sometimes it won't. It's also a really important tool for us to utilise to gauge what we're going to do from an impairments-based testing during that assessment coming up next. So for this particular athlete, we had them running on a treadmill. And the first thing we did was analyse a side-on view. So really looking at sagittal plane motion, flexion and extension primarily. Now, within that, what this athlete was displaying was an exaggerated forward trunk lean during their gait cycle. Now, we know from the research that a forward trunk lean as opposed to a neutral trunk position has a higher association to lower back pain. We know that it increases ground reaction forces by around 20%. That has implications for loading across both the lower limb and the spine throughout their running. We also know that it increases peak braking force, which means subsequently the athlete has to work harder during the acceleration phase of gait. So energy-wise or metabolically, it's very inefficient. And lastly, and most importantly, as a cofactor behind this athlete's low back pain, it introduces a quasi-isometric load across those spine extensor muscles, gradually sapping their capacity. Tightness will become discomfort, and discomfort will become pain over time. So you'll hear it build over a run assessment or their game time, etc., sport dependent, of course. The second thing we picked up from a side-on view was poor lumbo-pelvic control, so that exaggerated anterior pelvic tilt coupled with lumbar spine extension. Now, because of the origin insertion point of the abdominals on the front aspect of the trunk, we know that they're a key muscle group that can help control that poor lumbo-pelvic visual cue. And so immediately I flagged the abdominals for assessment during our impairments-based testing coming up next. The second thing that I noticed was it was during the toe-off phase of their gait that we really noticed the exaggerated lumbar spine extension. It got even more so at that point in time. For athletes that have deficiencies within power or strength of their hip extensors, primarily glute max, they typically will compensate by overextending the lumbar spine to gain more momentum in the acceleration phase of gait. So seeing that cue, immediately flag the hip extensors, specifically glute max, to go and assess during our impairments-based testing. Now, this wasn't present within this particular athlete's case, but I want to really highlight the point that different visual cues carry with it a different testing protocol in your impairments-based section. So if this athlete was to display a positive Trendelenburg sign, so if you're looking at them from the either front or the back, and you're noticing a contralateral pelvic drop, we know that's a positive Trendelenburg sign. We know that our hip AB ductors can help control that. So I'm going to flag them for assessment, not my hip extensors if I was to see that. Likewise, excessive side-to-side trunk motion. I'm going to start thinking obliques, QL, and side plank assessment in my impairments-based testing. So the differences in visual feedback on each of the gait cycles and different planes of movement absolutely change what you think may be relevant in your impairment-based testing, and also what may be interrelated and a cofactor to that athlete's low back pain. So that is our run-based assessment.
That's good, mate. It's I like that. I think it all sort of harks back to like looking for impairments. Watch them move, watch what they do. If you see something that just doesn't quite look right, maybe go and have a deeper look and test, and like those points that you raised. If you find that Trendelenburg, so go and have a look at your hip abductors. Or if they're seeing some trunk sway, go and have a look at their side plank. I think that sometimes the things that we often overlook, particularly when it comes to low back pain, it's like, well, there's so many different treatment options out there, and more often than not, we're kind of giving a lot of general kind of advice. And some people actually sort of need to have maybe some, like the local tissue needs to be sort of targeted a little bit more, as well as we've got that general stuff as well. So, yeah, no, it just makes good clinical sense and really good, strong clinical reasoning. Would you always test on a treadmill, or do you sometimes just get them to run?
So actually for the masterclass we did the treadmill, but it was on field for this athlete, so I wanted to get a lot more space and an ability to really see like how they move over a bigger distance. So we actually did a field-based assessment, which tells you a lot. Treadmill, there's pros and cons for everything, but yeah, having a big field was fantastic to work with. And you're highlighting the point that I wanted to make as well, which is that just because they're low back doesn't mean that there isn't deficits that we need to look for and that may be related. They might not, sure, but they may be related. And so part of the fun of what I do is looking at different sports and how they're moving and seeing whether or not it may be related to their back pain. It's one of the best parts of it. It's lots of fun, it's very high paced, it's very quick. And then you can quickly do assessment on that region to say, hey, am I right? And am I seeing something that's related to how they're moving or not?